here at this camp meeting this year. We'd like to thank you for the many presentations that we have had this morning that we can benefit from. As you have said, the health message is the right arm of the gospel. And as we listen to health now, help that we may submit our entire bodies to you. We may eat the way that you would have us eat. We may exercise. Help us to listen to the teachings that you're bringing to us day after day, week after week. We ask you to bless especially the women here as we are about to discuss breast cancer and prevention. We ask you to bless the men and help that they may be supportive of the women. And we ask you to continue to be with your people. Help that as we have the knowledge, we may put it into practice and fortify us with your truths. For Christ's sake, amen. Now, if I was to ask by a show of hands, all those who knew of somebody who had breast cancer, let me see with a show of hands, all those persons who know or knew of some person that had breast cancer. And if I don't see your hand up, then I can say Sister Rosalind, because we lost her only last year. This is a year now, and she died of breast cancer. So in thinking about the presentation to do, I realized that everyone around me was either dying or getting breast cancer. And I said, you know, maybe this is a topic that we need to touch on and see how we as a people can prevent ourselves in some way from getting breast cancer. All right, so these are the areas that I'm going to cover. How common is breast cancer? What is breast cancer? What causes it, even though we don't know? What are the risk factors? Can breast cancer be prevented? Tests to find breast cancer early, and what you can do. So that is going to be the focus of the presentation. The most common cancer in women in the entire world is breast cancer, and it's the second leading cause of death in the world. In Barbados, in 2017, there were 87 deaths from breast cancer, which was 3.25% of all the deaths was breast cancer. And the age-adjusted death rate was 35.64. This is per 100,000 population. Barbados ranks number 3 in the world. There's nothing for us to be proud of. Number 3 in the world in breast cancer. This is according to the World Health Organization. And breast cancer in Barbados is the 6th leading cause of death in Barbados. And men, let me say to you, prostate cancer is the number 1 cause of death in Barbados. So that is also very alarming. Now, the female breast is made up of 3 parts, you can basically say. The lobules, and these are the milk-producing glands, and then the ducts, which are the tiny tubes that carry the milk from the lobules to the nipple, and then there's stroma, which is the fatty tissue and the connective tissue surrounding the ducts and lobules, and blood vessels and lymphatic vessels. Now, men have breasts as well, but men tend not to get breast cancer, all right? But they do have breasts. Cancer is the growth of abnormal cells. And let me just clear up a little myth here. I heard some person saying that we all have cancer cells. This is a false statement. This is not true, okay? When our cells start to multiply and become abnormal, those are cancer cells. We're not born with cancer cells, and nobody has cancer cells. The cells can invade and damage the normal tissue. So we have normal tissue in our breast, and the cancer cells, when they start to get abnormal growth, and you're not absolutely sure why a cell suddenly becomes abnormal. Scientists are still trying to figure that one out. All right? But anyway, they invade and they damage the normal tissue. And breast cancer can start in any part of the breast. And that's why there's so many varieties of breast cancer, as you'll see shortly. Now, the types of breast cancer. There are many, many types of breast cancer. I heard one person said there are over 200 and something different types. But here, the main types I'm going to mention, the ductal carcinoma in situ, the invasive or the ductal carcinoma, the invasive, which is the infiltrating lobular carcinoma, then there's inflammatory breast cancer, and then there's metastatic breast cancer. So these are the main cancers. Now, the causes of breast cancer. Really and truly, we do not know exactly what caused breast cancer. We can say that things are associated and then there are risk factors, but we're not really clear what the exact cause is. But most likely, the cause is related to the genetic material, the DNA in our cells. And the DNA changes are often related to our lifestyle. So depends on how we live. That is one of the major factors. And then there's also age. As you age, then you succumb to a lot of these things. And then there are a lot of other factors that we will mention. So these are some of the risk factors. Gender, being a woman. Just being a woman is a risk factor for breast cancer. Then aging, as you get older, then you're more at risk for getting breast cancer. And then there are genetic risk factors. 5 to 10% of all the persons that get breast cancer have a gene. Now, my family have a gene for breast cancer. I had a cousin that died about 3 years ago, and she had the gene. Her sister was tested for the gene, and she was positive. And what they would do is every 3 to 6 months, they would check her for breast cancer. And 2 years ago, she had type 1, stage 1 breast cancer. So they caught her early, and they were able to remove both breasts and the uterus. And she's pretty healthy. But that's because that was early detection. All right? And all of her children had the genes. I haven't been tested, but we know a very close relative of mine 3 weeks ago just got diagnosed of breast cancer. So the gene is there. You can't do anything about it. So that's one of the factors that you can't do anything about if you have the gene. Then there's a family history. Not necessarily have the gene, but a number of persons in your family have breast cancer, then you are more at risk to get breast cancer. Then there's the personal history. Now, if you have what we call lumpy breasts, all right, then you need to get them checked very often. And there's a possibility that you might have breast cancer. Now, if you have breast cancer, it doesn't make sense saying, okay, I have breast cancer, I'm not going to do anything about it. I'm not going to remove the breast or anything, I'm just going to live with it. Chances are then you will develop breast cancer again in another part of the breast or in the other breast. And what we do here in Barbados too, I don't know how the doctors try to advise the patients, but here, even in Sister Rosalind's case, she had one breast removed and she left the other breast on. Now in the US, if you have breast cancer, they advise you to remove both and your uterus, because they don't want another cancer to form in the other breast or to have spread to the other breast. So that is what they recommend over there. And I therefore recommended that to her as well. So there's the personal history. Then there's certain non-cancer breast problems. Some people just have breast problems. And then that in later life can expose you or put you more at risk for breast cancer. And then there's previous chest radiation. That's why we should avoid as much radiation as possible, because that too can expose you or be a risk factor. Then there's post-menopausal hormone therapy. When some people are trying to take hormone therapy, then that can be a risk factor as well. And then there's recent use of hormonal contraceptives that can expose you. So you have to be careful the type of contraceptives that you're using as well. Okay, and another risk factor is race, black people. We don't know why black people are more at risk or die faster from breast cancer, but this is the case according to research. So race. Then there are persons that have dense breast tissue, and that too put you more at risk. Not having children. Some people think it's good not to have children, but not having children put you more at risk for breast cancer. Not breastfeeding. That's why we keep encouraging persons to breastfeed. Having a longer menstrual cycle, meaning that you started early and you ended late, then that put you more at risk as well. And then let's come to the things that we need to talk about a little later, but very closely. Physical inactivity. This morning we went walking and we had about what? Less than 10 people. We even had some young people that we couldn't figure out why they were walking so slow. Sister Flo and I were trying our utmost, Aria, to get them to walk a little faster. But they were just lagging and lagging and lagging. So not even the young people are interested in exercising these days. So physical inactivity puts you at risk for breast cancer. Overweight. That's another area that we all have to work on. Alcohol use. That might not be such an issue here, but that is another risk factor. Red and processed meat. That is another risk factor as well. So how do we prevent breast cancer? Now, there are some areas that I'll touch on. Some of the extreme ways of preventing is actually some chemicals that they give you, which is called chemoprevention, use of drugs to help to prevent you from getting breast cancer if you're so at risk. And then surgery. Angelina Jolie, she has the gene for breast cancer, so what does she do? Just go and take off both breasts. So if you don't have breasts, then you can't get breast cancer, right? So these are the two extreme views that people hold to. But then there's no sure way of preventing, but you can reduce the risk. Because as I mentioned, there are some factors that you can't do nothing about. You can't do anything about being a woman. You can't do anything about being black. You can't do anything about having a gene or having a family history. These are things you can't do anything about. But there's some things that you can do things about. Diet, exercise, these are things. Now, screening. Now, every year, after 45 years of age, you should be screened for breast cancer. Let me see all the women in here who within the last 2 years had either a mammogram or an ultrasound. I am seeing 4 hands, 5 hands. Okay. Now, it's important. Early detection is extremely important. Same thing for men and prostate cancer. If you pick up that you have cancer early, then they can pick you up at what we call stage 1. So if you have a cancer at stage 1, then easy surgery and you are almost cancer-free for the rest of your life. All right? But if you wait until you get to stage 3 or so, then you already have some spread. My cousin actually was a nurse. She should have known better. You know, when she found out she had cancer is when it was spread to her back and she was walking with a stick because she never went and had a mammogram or had anything that can detect breast cancer. All right, so let us be wise and make sure that we do the right thing. So what can you do to prevent and beat breast cancer? Let's hear some of the things that you can do. One of the major things you can do is to change those risk factors that you can control. Now, I mentioned a number of risk factors. Some you can control and some you can control. So the first thing is to change all the ones that you can change, like your weight, like your diet, making sure that you're physically active, Those are things that you exercising regularly. You can change all those things. So let's start here with the weight. Get to and stay at a healthy weight throughout your life. I know for women like me, it's a struggle, but yet I'm in the gym every day. So I'm making sure that I am exercising. All right? But as your metabolism slows down, it is more difficult to keep that weight off. So you have to make sure that you eat less. So this is something that as women we have to work with. Be physically active. And physically active doesn't only mean exercising. It means doing a lot of stuff at home, etc. Rather than just lying and sitting around, you're doing stuff, whether it's gardening, whatever you're doing, you're being physically active. You have to limit the sedentary behavior. Don't spend hours and hours just sitting down on the computer or watching television. You have to do a bit more than that. And cut out alcohol. Get screened. And I'm going to show you a video shortly. Let's hope that it shows. But it's important, as I mentioned, to be screened regularly. 45 years or older, annual breast cancer screening. Talk to your doctor about your breast cancer risks. You should know your risks. Doesn't make sense saying that, I don't really know if I'm at risk or not. You need to talk to your doctor and know if you are at risk. So there's questions that the doctor would ask you to give you an idea if you are at risk or not. Educate yourself on diet and lifestyle changes. And we're so good in our congregation that Dr. Douglin is here Sabbath after Sabbath telling you about some of the foods that you can eat to help to protect you. Take responsibility for your own health. It's not the doctor's responsibility, it is your responsibility. And a lot of times we hear things and we just ignore them. And it's only when you get sick, then you start to think about it. Do. Put the knowledge and the information into practice. If you know something, then do it. It's just like the truth. You study the scriptures and we put them into practice. The same thing with our health. We have to put it into practice. So I'm going to show you a short video. It's going to be graphic because we want to show it to you. All right, so just watch it. Are we not getting, we want to see and hear at the same time.
Self-breast exam. Each month, right after a period, plan to examine your breasts. Start by looking in the mirror. Look for any skin changes or visible bumps on the surface. Raise your arms above your head and then back to your side. Watch for any dimpling or retraction of the skin. Use this portion of your hand. It's a good way to feel for lumps. With your arm raised above your head, use a circular movement to feel for lumps. Breast tissue is normally a little nodular and bumpy. Some people say it's like feeling for a marble in a bag of rice. Check for nipple discharge. A few drops of clear, milky, or green-tinged nipple secretion is normal. Bloody nipple discharge is considered abnormal. Once a year, have a professional breast exam. Mammograms can be very helpful at early detection of a number of problems. Many doctors recommend mammograms every other year for women between ages 40 and 50, then every year after age 50. If you find a skin change, lump, or nipple discharge, see your healthcare provider right away. Most of these problems prove to be innocent, but the best chance for treatment of more serious problems comes with early diagnosis.
Okay, you saw the brief self-examination. Now, most of the breast cancers are diagnosed through self-breast examination, believe it or not. So it is up to you every morning, every week, decide whenever you make sure that you check your breasts so that you would be in a better position. If you check and you feel a lump, then you go to the doctor and say, I'm feeling a lump in my breast. All right? And then they can examine you. They can send you for a mammogram or an ultrasound. And then you're on the way to getting early detection and treatment, surgery and treatment. So that is extremely important. All right? I hope he started at the right place. All right, can you help prevent breast cancer through a healthy diet? All right, let me just go backwards and make sure, because, yes. All right, making good choices at the grocery store is very important. It's not a magic bullet, but we know by eating a proper diet and eating certain foods, we can reduce our risks. So because you eat a good diet and you eat the correct foods, it doesn't mean that you will never get breast cancer, but it means that you're reducing your risk of getting breast cancer. Okay? And research has shown that. All right, it is estimated that 25 to 30% of the cases of breast cancer can be prevented. So we want y'all to be in that 25-30% group by eating and exercising daily. Prevention diet should include whole grains, fiber, fruits, and vegetables. And what I've done, I've selected some of the main vegetables and fruits that help to prevent breast cancer. So fruits, grains, fiber, and vegetables. All right, the first one we're going, I don't think this was it, is turmeric. Turmeric fights against inflammation. And you can use turmeric either in your smoothies or you can use turmeric in your food. Whenever I cook, I use turmeric. And some people use curry. Curry has in turmeric as well. But turmeric is the safer form. All right? So if you're using, especially if you're using chickpeas, you can use a lot of curry or turmeric with it. And curcumin is the active ingredient that you want to get. So the fresher your turmeric is, the better it is for you. So this curcumin helps to fight against breast cancer. Broccoli. Every day you can use broccoli. And broccoli has an active ingredient called sulforaphane. So, and that helps. That's why some people might say, okay, it upset my stomach or something because of the sulfur, or you're passing gas because of the sulfur. But broccoli is excellent, and that helps to slow down the growth of any tumor. So even persons that have breast cancer should be using a lot of broccoli so you can slow the growth of the breast cancer. Garlic. Allicin is the active ingredient in garlic. So the fresh garlic, you grate it and you use your garlic and onions, and that gets right down to the cellular level to help to prevent breast cancer. So garlic is one of the key foods in preventing breast cancer. Apples. The active ingredient in apples here is anthocyanins. They say even the apple seed have cyanide. So the apple itself have a safer form, which is the anthocyanins. So if you eat an apple, you know the old adage, an apple a day keeps the doctor away. So every day you can eat an apple, and this helps to prevent breast cancer. Pomegranate. Some people prefer the concentrated pomegranate juice rather than just using a few. But we used to have lots of pomegranate trees all over the place. I'm not seeing as many now, but they're still selling pomegranates even in the grocery stores. You can buy your pomegranates, the big red ones. So, and that has an acid called ellagic acid. That is the active ingredient, and that prevents breast cancer. Walnuts. You also get walnuts tend to reduce the tumor growth as well, and that's the omega-3 fatty acids in walnuts is the active ingredient. So you need to use small amounts of walnuts every day. Walnuts are expensive, and some people just prefer to go and buy peanuts and eat, but the walnuts are the ones that have the nutritional value that would help the omega-3 fatty acid that will help reduce the breast cancer, your risk of breast cancer. So you have to invest in yourself. Flax seeds, either ground or whole, these two can help to fight off, and the active ingredient is the lignans in the flaxseed or the flaxseed oil. So you need to use flaxseed or flaxseed oil to reduce breast cancer. Sweet potatoes, I heard yesterday, sweet potatoes was mentioned. So all of the carotenoids, we have lots of mangoes now. So you can use mangoes, you can use cantaloupe, you can use the rich yellow sweet potatoes, you can use carrots. All of these carotenoids help to reduce your risk of breast cancer. And then it comes to the berries. The berries are a little more expensive, but again, you invest in your berries, especially the blackberries and the blueberries. And these have phenolic acid, flavonoids, and anthocyanins and thionins. So these are all the active ingredients. You don't have to worry about the active ingredients, but this is to show that these active ingredients are acting on your body to prevent you from getting breast cancer. So if you want to educate yourself, you can know the active ingredient, but the important thing is eating the berries, either in shakes or just washing them. Our grandchildren like to put them in the freezer, freeze them, and just take bowlfuls and eat them frozen berries. So that is good too. So however you choose to eat them, make sure that you're getting strawberries, raspberries, blackberries, etc. Our natural fruits, the thing with our natural fruits, they're excellent, but they have not been tested to the extent that some of these fruits have been tested to. So I can't say to you, okay, gooseberries, but yeah, go ahead and eat your gooseberries. But I am not sure that you're getting the same active ingredients as in these, okay? And the last one is green tea. Now, I haven't exhausted all of them, but these are the ones that are key in terms of fighting breast cancer. The green tea can soothe your mind and protect your cells, and it has amino acid L-theanine. So if you use a lot of green tea, and decaffeinated green tea is what I would emphasize, because it's not the caffeine that you're trying to get, but in fact, it is the amino acid that you're trying to get to help to fight the cancer. So that basically is an overview of breast cancer. So I just want to remind you of some of the things that you should do. The first one is to exercise. Exercise, even though you might look slim and think that you look slim and fit, you need to exercise. You need to benefit from the exercise. You need to make sure that you reduce your weight. You need to make sure that you eat a lot of fruits, vegetables, and fiber. Okay? These are some of the things that you have to do. Early detection is important. Early detection means that every year or every other year you get either a mammogram. The MRIs are way too expensive, so I don't expect persons will get MRIs that often, but an ultrasound. Because as my husband would say, recently I decided to go, and I thought I would go and get a mammogram. He said to me, nope, no mammogram, you go and get an ultrasound. That was his choice. So you pay a little more. I think the ultrasound was actually over $200, while the mammogram is probably half the price. All right? But the most important of all of those is the self-examination, which is free. So you just saw a video. You can even Google, and you can look at it again. Online, you can find a lot of stuff. You can Google breast self-examination, and you can see exactly how to do it, and you check your breasts on a regular basis. If you are still having a menstrual cycle, the recommendation is a week after your menstrual cycle. If you're not having a menstrual cycle, you can do it every day. That's fine. All right? But the important thing is early detection. Prevention first, and then early detection. So you're doing both simultaneously. Okay? So that is it. I think we have room for a few questions. If there are any questions, I try to make sure I wasn't too long, and I try to bring it down to everyone's level so that everybody would understand the presentation. But I just want to emphasize that let's not take it for granted. A lot of times we figure it could never happen to me. I'm sure Sister Roslyn thought that she would never have breast cancer, being a vegetarian for all these years, exercising, doing everything right. Okay? And just recently, as I said, a very close family relative, 3 weeks ago, diagnosed with breast cancer. Last year, another person. I actually have 3 of my netballers on my netball team who have breast cancer, and they exercise on a regular basis. One is actually now in Wildwood getting treatment. So, I mean, this is something that we have to be aware of. It's all around us. So we need to work on it. We need to do something about it. We need to educate our peers, and then we have to make sure we educate ourselves and do the right thing. Okay? Any questions? Yes. I think there's a mic there. And I will invite Dr. Douglin, who's the medical practitioner, to assist me with any questions that are more medical. Yes.
Yeah, I'm glad that you mentioned Dr. Douglas' input about the ultrasound, because in my experience, if you ask every woman who had breast cancer about the mammograms, they all had perfect mammograms. And it's only when they examined or their husbands fed something that they knew they had breast cancer. So I would say the number one thing would be the ultrasound. Mammogram is a waste of time, for me. I think so. But Austin's asking what proof I have to say that.
Yeah.
I said earlier, every woman I talked to who had breast cancer had perfect mammograms. Recently, I spoke with a lady at work, and her mammogram a few weeks ago was perfect mammogram. And 2 weeks later, she had a breast lump, breast cut off. So the next thing is the preventive measures, the fruits and the vegetables and so forth. We are buying a lot of things that says they're organic, and they're not. They're fooling you with that. So you have to be sure where you get your stuff from when you're using that, when you're using those things, the blackberries and the blueberries and the pomegranates and all these kind of things. Recently, I think it's in Turkey where most of our pomegranates come from, those big, juicy ones you're talking about, and they have found that they contain more pesticides and mercury than they should contain.
Wow.
So,
yeah. All right, thanks very much. And I didn't want to throw the mammogram through the window, but I mentioned that because a lot of people that had mammograms, it tend to slip through, right? So self-examination is key. self-examination, because even when I went to get the ultrasound, the doctor said to me, "Why are you coming for an ultrasound? Did you have a mammogram?" And I said, "No, I just bypassed the mammogram and came straight for the ultrasound because my husband told me to come for an ultrasound." So he probably was there wondering, so who is your husband? You know? But anyway, that is important. And I agree with you, Brother Reggie, because even before Sister Roslyn had the cancer, she had a mammogram and examination just like the December, which was like almost 3 to 6 months before her diagnosis. So I don't want to throw the mammogram through the window, but the self-breast examination is even more important than the mammogram. Yeah, I saw another hand over, yeah. Go ahead. I think I saw a hand over here, but I'm not seeing it anymore.
Of course, there's a lot of information that show that mammograms really don't do anything apart from crush the ladies' basically, to put it that way. But my compressed, you know, I heard a lot of ladies complain, I heard.
Complain about the pain, yeah.
My question, though, is on, you mentioned that black people, or black women in this instance, tend to have a higher, is it a higher incidence, or is it the incidence of it, or the outcome is worse for them?
Well, there's research that's stating that the outcome is worse.
Right, because
Yes.
what, from an epidemiological perspective, which you obviously would be on as well, I remember that it is more a class thing than a race thing per se, even though race factors into class very easily. That is, women in what we call the higher classes have lots of these problems, but because they can pay, like for example, you're speaking of, rather than have the mammogram, you went and had the other test.
MRA.
So that what they're saying is, that what they're noticing is that women who, you know, of course, most of these so-called upper-class women, their diet is not necessarily the best. But what they're saying is that because they're able to have this money, disposable incomes at a higher level, they're able to get certain treatments that the other woman is unable to get. And therefore, they're saying that while, and you were probably right in Gordis, for example, that while both groups of people might have a similar incidence, as it were, the outcome for those who don't have the necessary finances is always worse.
Yeah.
Because let's look at Barbados or the Caribbean. A woman who is lesser off in terms of finances has to wait on probably, let's say, the only acute hospital they have in their area. They have to sometimes spend long periods in order to see these people. A richer person might go to Mount Sinai Medical or somewhere in Florida or whatever, and immediately they are taken care of. So they say the outcomes are worse for the poor people because they can't access the kind of care that they're having. So what you are doing is, to my mind, an excellent thing, prevention. And that is really the key that we should, as third angel movement people, follow the light of the health message, should really be pushing. And I really appreciate what you're doing, really.
Yeah, yeah. And Brother Austin, that is extremely right. And as you know from a public health practitioner, that is the public health problem. You know, the poor people always have worse outcomes because they can't access and benefit from everything. And just to give a brief example, I mentioned a close relative who was just diagnosed, and because she was having Obamacare, a lot of the doctors were not taking that particular health insurance. So she had to keep going from here to there to here to there, you know, to try to access the critical care that was needed. So she ended up having to change the insurance to a higher level insurance in order to access the oncologists and the better doctors to make the critical diagnosis. So this is something that happens not only here, but even all over the world. Yes, continue.
Word insurance. You know, I said this in this church for years. I'm not talking about the insurance that people say and nobody say they don't get life insurance.
Right.
But I believe that we live in a real world, you know. And we're seeing people dying all around us. The minimum I believe that we could do is get some health insurance.
Yeah.
That's what I believe with all my heart. Because while it doesn't save you, it can help, in actual fact, do something for you to access care. And on this, like you're saying, this core, I think that is important to be educated on having health insurance.
Yes.
I mean, the different levels of it. And we should be people who at least look at that. You're not trying to safeguard your life. By that, I mean, say you want money for people after you die. But I believe that, you know, health insurance is a good investment because it means you might not be able to pull out $5,000 to get a treatment, but at least you could fall on the insurance, depending what type of insurance it is, and at least could ease you. And the burden on your family will be significantly reduced, and the frustration, the fears, and everything. Not that that will solve the problem, but I think it would at least go a certain way in helping people because we've seen it too often, even in our church.
Yeah.
You know, and it's not a sin to have health insurance. So I think
Very good point.
I'm not an insurance exec or anything so, but I think wisdom will say that, you know, health insurance, hear me a word, I said health insurance.
Health
I think it's
insurance,
critical.
yeah.
It's very crucial.
And I agree with you. And the thing is to get it early. You don't wait till you get a disease or something, then, you know, that would kind of block you and prevent you from being able to access the health insurance at the time that you want to access it. That's critical. I saw Brother Reggie and Sister Flo.
Yeah, I also wanted to add, because you mentioned that Barbados has a high population of breast cancer in women. I think Dr. Douglin could assist you in this question that I'm going to ask. Because recently I've been reading that in black people, the TNF, the tumor necrosis factor, interleucin 6, interleucin 12, those are the ones that help your body to fight cancer when it starts to come up. And I'm reading that they're finding that they're lower in black people than in Caucasian people. I don't know if Dr. Douglin has this, any say on this. Interleucin 12, interleucin 6, and the TNF, the tumor necrosis factor, in black people, they say they find that it's lower than in the Caucasian population.
And what they're saying that causes, that I just want to follow through the argument because interleukin and those are inflammatory markers. And an inflammatory reaction can either be beneficial or destructive. For example, if we are mustering an inflammatory process to fight viruses and bacteria and so on, that is good. But some people muster their inflammatory process to fight self, like an autoimmune disease, and just to create increased levels of inflammation. So it depends on how these molecules are used. You said the research was saying that because it was lower in blacks, what was the result?
Yes, they're saying that the interleukins actually help to identify the tumor cells so that the body can attack them. So they're lower in black people, which means that the tumor necrosis factor can't act adequately enough to fight these cancers. That's why when they find it, cancer in black people, it's actually higher and faster than in the Caucasian person.
Because they're not attacking the cells with these pro-inflammatory molecules. Well, I will check that out because you have another school of thought that when you see, as I said, you have tumor necrosis factor alpha and tumor necrosis factor beta, interleukin 6, and then you have the other prostaglandins and the complement activation factors. If the inflammation, if these factors are causing inflammation, it is trouble. If they're not causing inflammation, but they're used to search out cancer cells and kill them, that is positive. And it seems that various races and various individuals have aberrations of how they're used. So you have to look at the whole picture. But the point would be well taken that if a person is not having these molecules to attack cancer compared to another race that has them to attack cancer, the risk would be different. But it's a really complex thing. Thanks. Now, things like beta-glucan, found in wheat bran, for example, and vitamin C, and certain what we call anthocyanins, they do something like grapeseed extract, for example, and vitamin D3. They sharpen the immune cells to attack cancer and foreign material and help to prevent it from attacking self. So that's why nowadays most autoimmune patients are put on a good dose of vitamin D3 and grapeseed extract, because you want the immune system to be searching out and attacking cancer and foreign invaders and not self. So all the antioxidants will sharpen the immune system, but vitamin D3 and grapeseed extract, for example, and curcumin from turmeric, not only sharpen the immune system, but balance it so that it can search out cancer and not attack self. As a matter of fact, curcumin has been shown to be the key molecule that will stimulate the immune system to search out even the so-called master cells that chemotherapy can't touch, and that will go and hide. That's just a touch on it.
I just wanted to say a word on some of the foods that were mentioned that we could use to help to prevent or lower our risk, I should say. And I noticed you said that the research wasn't done on our local, like fruits and so on. But I would like to big up our local fruits just based on the quotation from Ellen White when she talks about those foods that are grown in your locations are good for those people who are from those locations. So in other words, yes, the berries have been tested, but I think even without our akis and dunks and such like being tested, we can still go go on them fully because, and akis and so on, because they have what's good for us in our localities.
Very, very true. And I would not ever recommend replacing them. Like I said, all fruits and vegetables are adequate. And when you look at berries, a gooseberry is a berry. So even though you might still take some of the other berries, consider it as a berry too, and consider it as having some of these same properties. All right, we have 5 minutes. Any last questions before we close off? Yeah, go ahead.
We were talking about research in our local area, but I remember, I know you would too because we did a similar program. CFNI in Jamaica used to produce, I know they had a change or whatever, but they used to produce research on the fruits of the Caribbean. Mm-hmm. And I had some booklets and so on that I gotten that showed like the sweet potato that is now massive. Mm-hmm. Before 2000, I have picked up some information showing that this is what our type of sweet potato, American call that something different. But our sweet potatoes, we all know they're very high in the antioxidants and so on as well. But they have done quite a bit of work on showing the kind of content that we have in our various foods. So that is a site you could go on, University of West Indies and so on, and also get some information.
Yeah, they actually did some research on breadfruit. They did some of the vegetables, But I'm not sure in terms of the tamarind and the gooseberry and some of those, smaller fruits, if enough research was done on those. But they do have benefits, so you can use all of those local fruits, even though you're using some of the other international fruits. Yeah. Right. Okay. So use your local fruits, whatever is in season. And like sometimes we have vegetables in season, okras. Right now, okras are glutting the market very cheap. So Kadisha would tell me they're cheap, so I eat it a lot. So she would boil a whole saucepan of okras and eat okras, and that's lunch. Okras. Right? So when something is plentiful, you eat a lot of it because you know it is good for you. So that's how you keep the cost down and still benefit from the fruits and the vegetables. Right now, mangoes are plentiful. You're getting all the carotenes you need, eat a lot of mangoes if you're not diabetic. So that's it. All right, yes. One last question and then we pray.
Just a comment. I want to
Yeah,
endorse what
comment.
Austin said as related to health insurance. Because Barb has a very good medical
Yes.
plan at present. I'm a part of it. And it has some very good benefits. And you can join it for any medicals up to a certain time. Right? So I would encourage members to join because it's very beneficial. Because in my previous job, I benefited from insurance, the same way health insurance, because let's say you had an operation for like $10,000. You won't have to pay like $2,000 and the insurance company pay the other $8,000. Well, on the other hand, you might not have that money up front. So to embrace what he said, I believe that we should all have some health insurance because it works very well.
Yeah. I just want to make a mention that is excellent. In Barbados, we don't push health insurance the way it is pushed in some of those other countries. And we rely a lot on our free health care, and we're not sure how long this free health care is going to be free. And also, there is a long waiting list for surgeries and for whatever. So even if you have, let's say, breast cancer, don't think that you're going to get all the surgeries free and all the chemotherapy free and all the radiation free. You have to pay for some of it. And people don't realize that until they're put in the situation, and then to realize, okay, I can't get my chemotherapy and radiation the way I would like because I have to go on a long, long, long waiting list. So we have to be very careful and note that health care that is free is not as accessible as if you have the money to pay. All right? So let us bear that in mind as well. So having health insurance is definitely a benefit. Now in the US, everybody has to have some form of health insurance so that they can access the medical care. All right? And I remember a couple way back, Billy Miller, when she was the Minister of Health, she was trying to push the health insurance aspect here in Barbados, but it never really took off. And with the economy as it is now, we're going to have to start looking at the health insurance route in order to make sure we access all of the medical care that we need to get. All right? So let us bow our heads to close off. Dear Father, we'd like to thank you for a wonderful morning. We'd like to thank you for the information that was presented in your word about preventing breast cancer and prevention in general, because we know that some of these same fruits and grains and minerals can help to prevent all types of disease. Continue to give us the knowledge and the wisdom, the education that we need, and help that we may put it into practice and we may follow your health principles as you have laid out for us in your word. Guide and direct us now. Give us a good lunch and bless us, dear Father, for Christ's sake. Amen.